Okay, we should be recording. Hello, everyone, and welcome to today's video. We're going to be doing another guest speaker video today. As you know, my name is Emma Herzog, and I'm going to let our guest speaker introduce herself, and then we'll get started learning about her and her job.
My name is Edith Parajon, and I am a marriage and family therapist.
Wonderful. Would you mind just telling us a little bit about where you work and how you got into your line of work, Edith?
Absolutely. So I actually graduated as a dual major from Cal State San Bernardino in psychology and human development. My emphasis was in child development. From there, I went the mental health route and not and focused more on that piece, which then I received a master's in clinical counseling psychology, also from Cal State San Bernardino. Um, And I've been working with children for the past 19 years
Wow.
in various settings. I did some social skills groups, but I've ultimately kind of ended up in the mental health world providing therapeutic services to children and families.
Wonderful. We'd love to know a little bit more about what you need to get started to do that. I know you mentioned that you graduated from Cal State and you
Mhm.
were originally in psychology. So, what kind of skills, credentials, degrees do you need to get where you're at?
To get to the level of actually providing more of the mental health therapeutic clinician, as we call it, therapist relationship, you do have to have a master's to do that. And that could be a master's in marriage and family therapist, like I currently hold. It could also be a clinical social worker as well. We also work with a lot of psychologists that are just have a master's or a PhD in psychology can also do therapeutic work with the children. So that's at the master's level, more of the clinician type. But at the BA level, there's also a lot of positions working one-on-one with children and families. But those positions are not necessarily providing therapy, but more of support with social skills, behavioral support. But those are at the BA level.
Okay, but there's still something if you're working towards different degrees that you could have in their
Yeah.
field. Wonderful. And if you don't mind sharing, how much on average would you say is a starting salary in either of the positions that you just described?
So typically for your bachelor's level position, so your as we call it our entry level positions, those are being starting hourly around $19 an hour. Again, those are entry level positions within an organization. Most organizations are nonprofit, therefore our uh, budgets for salaries are not at the higher end. However, there's always room to grow within the organizations. Like I mentioned, you would start off as an entry level bachelor's degree, but then you can work on your master's degree while you're working. Actually, the organization I work with does offer like tuition reimbursement as you're working on a degree that you can ultimately grow within the organization. So as you grow, then it's more of a, let's say you were to get your master's degree, then that would be into I believe right now we have our clinicians starting, which is our entry level master's positions. I believe they are starting around the $60,000 a
Okay.
year.
Okay, so it just kind of depends on where you're at and what you're doing
Right.
currently. Awesome.
Base.
And I completely forgot to ask you as we got started, what kind of got you interested in this field? I know you mentioned that you didn't originally start out with doing mental health services, but what made you interested? Was it a class that you took or just your own areas of working in the field as you got further along?
It was just working in the fields, got further along, like you were mentioning. I ended up having connections to somebody at Cal State who was more in the mental health world, working with children and adolescents. I was connected with her and just kind of listening to the work that she did, I found that that was really where my heart was. I did love the child development piece of it too, and I do feel that it's still really important and it does get incorporated even in a therapeutic setting. So to me, having that child development background was so crucial as well. But mental health was really an area that I was drawn to. I felt like I could also make a bigger impact because we are working with children and families that are in need.
Sure, that's beautiful. Excuse me. As we mentioned earlier before we started recording, we're both recovering from being a little bit sick. So
Yeah.
I do cough or my voice is not up to par. That might be why. But yes, I too also have a heart for mental health services and the mental health aspect of
Mhm.
my career as well. Would you mind just sharing some challenges that you have faced either currently or along your journey in your workplace, or just I know mental health can present challenges in itself in that
Yes,
regard.
it does. It is a challenging field to work in. It really is, but it's also very rewarding. And I do want to acknowledge that we do have difficult cases, and I wish I could come in here and say it's gonna all be all great, non-challenging cases you're gonna get, but the reality is that it is challenging work, but it is also really, really rewarding. To me, I when I would get clients and I get clients, I would see kind of the history that the child might have, the abuse that they endured, or what happened. And I know there's a history there, but just working with them and seeing that child come out and just be so engaged and so happy, to me, that's the rewarding piece of it all. I
Wonderful.
know that they've been through some horrific stuff, because you do see that. And I think that's one of the biggest challenges. The reality is, I think sometimes people think we're robots and we don't have feelings, and we do have feelings, even though we're clinicians. And I think that's why there could be such a high rate of burnout rate for mental health in general for workers. And that's because, again, it's challenging, and we're human. So we do take some of that on ourselves.
Of course. Yeah. Thank you for sharing that. And how about just on the other end of things? I know that it was kind of both a challenge and a strength in
Yeah.
one. But any other strengths that you would say, or just personally things that you feel like you've been able to work on or grow through your experience in this field?
Yeah, again, it's just making an impact and a change, I think, has been the biggest thing to me as a clinician. Having a child graduate from our program because they've met their treatment goals, to me, that has been the reward of it all. And I think that's the where you feel like, oh wow, this is amazing. We I've worked with kids who have had some self-harming behaviors, and to go from a child who had thoughts of self-harming to not having any thoughts, um, that to me is just the biggest reward that I could get. So to me, that is the strengths that I see in it, that you do make such a great impact that will last for them their whole life, hopefully.
Wonderful. That's amazing. Just having those relationships with them and seeing that gradually support them.
Yeah.
Yeah, that's wonderful. Thank you. And I'd love to know now just a little bit about what a day in the life for you looks like, building those relationships, working with the children, kind of what you do day in and day out.
So every day is a little bit different depending on what the caseload looks like. Typically, as a clinician, you do conduct clinical assessments in which you determine diagnosis, you determine treatment goals. So some days typically they involved having some clinical assessments done with any referrals that might come in. And then from there, you have your established children that you see. So that involves, and again, everything is very individualized to the child and the family. So depending where the child is, where the family is, that's the type of treatment that you provide. So some children would get one-on-one therapy with a clinician like myself, or might only need to get some sort of behavioral support from the bachelor's level staff, which they do as well. And some benefit from a combination of multiple things, whether that be individual therapy, the support from the behavioral specialist, family therapy. So every day is just a little bit different depending on, again, where that child is and the family is. So typically, again, it involves doing maybe some clinical assessments, and then having your kind of sessions that are scheduled for the day. So again, it could be family therapy, or it could be one-on-one
Okay.
service that you provide. Yeah.
Yeah. Would you mind sharing a little bit about maybe what a session could look like? I know that each one is
Mhm.
individualized, and um, I forgot to ask, what age groups do you typically work with, or age
Uh,
range?
yeah, typically it's 0 to about 21,
Okay,
the
so
age
the
group.
sessions look very different, I'm sure.
Very, very different.
Yeah.
Obviously, with the infants, for example, a session is going to be more with the actual caregiver and not necessarily with the infant. So
Okay.
it's more of working with the caregiver for appropriate parenting skills, anything to kind of look at what would be out of the ordinary or normal, as a
Hmm.
lot of people consider it. So for the infants, it's a little bit different, right? Once you start getting into the verbal age and a little bit older, I would say preschool age, that's when you're able to do more of that play therapy, which is a
Sure.
big piece with the younger kids, right? So play therapy is just incorporating play into a therapeutic setting. So we are playing. It looks like we're playing, and actually, a lot of parents say, "Well, I feel like you guys are just playing." Well,
Sure.
it looks like play, but it's not really play because there
Yeah.
is a therapeutic component to it. So with the younger kids, we definitely have more of that um, play piece incorporated into it. And surprisingly, even with some of the adolescents really do enjoy play and playing board games.
Oh,
Even though they might think they're too cool for it, they actually do engage really well in sessions with that.
wonderful.
So with adolescents, sometimes it's playing, but sometimes it's more of that traditional talk
Mm.
therapy that you would say. Um, just because of their age. And again, you might have those that are really engaged with wanting to play a game with you or doing some sort of arts and crafts. And then you have ones that are like, no, absolutely not. As you get more into late adolescence and more of like your 19, 20-year-olds, that's obviously going to look a lot different because then that would look more of your traditional talk therapy.
Sure. But for that age group, that's how young adults play is conversations and getting to
Exactly.
know each other in that regard. Yes. So, would you mind just describing a little bit about the types of materials or tools? I know you had mentioned for the older teens and adolescents, potentially board games or just having more of a talk based therapy. But for
Mhm.
your younger friends, what kind of materials do you use? Does it look kind of like a home or daycare or classroom setting?
It's very based on the child that you're working with
Or
and what sort of maybe abuse that they endure that you set up the room
Mhm.
specifically for them.
Okay.
Or a lot of the organizations, they're community based, so you actually go out to the home to provide services. So I would have like a rolling office, you would say,
Yeah,
with all of my tools in there. But
sure.
in reality, is um, you really use any sort of toy that you traditionally would see or book, and you incorporate that into your play therapy.
Wonderful.
So I would have, for example, if I have a child who's maybe endured some sort of physical abuse in the home, I traditionally like to set up like a play home, like a dollhouse, we would say, with the family. And typically the child would then kind of reenact any sort of trauma that they endured there. So again, it's very based on what the child has enjoyed, that you set up games for that, or you set up read books to them about it as well. Baby dolls are a big one. Having like the doctor set is another big one. Pretend play and allowing that in therapy sessions is also very crucial. So I would have a lot of dress up items so they can dress up as anything they want. Figurines, I would have a lot of, you know, animals, princess, knights, dragons, anything that they can really reenact any sort of their abuse or trauma that they endure. They have the tools available to that. Also, for some of my kiddos that have had like anxiety, I like to read them some books of just how to do some deep breathing techniques. So it's very individualized, and you can honestly use anything in play therapy. It's just being creative
Yeah,
and
of
making it
course.
into play therapy. One
Wonderful.
of my favorite games that I would do with, and this one is also a big one with the adolescents, is Candyland. So Candyland has like the different colors.
Pick.
So I would make every color an emotion.
Okay,
And so every time they landed on that color, they're to express a time that they felt that feeling or that emotion.
that's wonderful, and that's just something that you're able to use with that game and apply it to all of those different ages.
Right. Yeah.
Wonderful.
So you don't necessarily need to buy any specialized play therapy toys. It's really like your regular stuff.
Sure, that's great. And I'm sure that that then is supportive for the families and showing them ways that they can interact with their children, especially when you're coming into the home and doing those services for them. Wonderful.
Absolutely. Yeah.
Is there anything else that you would like to add on to that maybe I didn't ask you a question on? This is not an area of my expertise, so I don't know all the ins and outs of what you do. But is there anything else that you might have to share for advice or just for someone who might be interested in this field? Just tips and tricks? Anything that comes to mind for you? And just
Um,
getting started.
I would say don't be afraid to get on the floor. Also, one of the things as a young uh, mental health worker coming into the field, I never, I now I understand it, but I think when I walked in, I didn't understand the power of a silent interaction and the therapeutic relationship and healing that's happening there. Sometimes, again, because of the trauma that the child endured, I might have a child who's very nonverbal during sessions, and that's okay. But I think as a new person coming into the field, you're like, I'm doing something wrong, but
Right.
there is value to that. Also, don't mind getting your hands dirty and again being on the floor because play therapy is very child led, which all of our child development classes tell us that, right? All play should be child led. And it's the same with play therapy. It is very child led. So just follow their lead.
Yeah, that's wonderful. Beautiful. And then I just had this question ruminating as you were discussing. How would you say you care for your mental health, being in this field, working with others and supporting their mental health? I'm sure that this is something that you also need to do on your end. Do you feel
Yeah.
that there's any just strategies that best work for you? Um,
Yeah. For me, is being able to, as hard as it is to be able to separate when work is done and then your personal life begins, because like I did mention earlier, there is a high burnout rate for mental health
sure.
workers, and just because again, everything that we endure, what we see, um, but it's being able to take that time away for yourself, whether that be, reading a book or going for a walk, something to be able to decompress from whatever your workday look like in order to help prevent some of that. I'm also a big advocate and I always kind of promote that you can always seek your own therapy if you need it too. There's a
Beautiful.
lot of professionals, therapists that work and are specifically for therapists
Sure.
because you can endure some of that burnout.
Right, of course. Wonderful. Thank you so much for sharing, Edith. Did you
Sure.
have anything else before we close out for the day?
No, if there's any questions regarding the field or just positions in general, you can feel free to reach out.
Sure.
And
I will
thank
make
you.
sure to follow up with you if anyone does have any questions. Wonderful. I'm going to stop the share now.